Hello friends, me Dr. Deepika
Me, Dr. Vinay Khatri.
welcomes you to this episode of Divyarishi Arogyam Sansthan, and today we will discuss about the most common disease, peptic ulcer.
Or we can say that the breakdown of the lower lining of the esophagus or the stomach or the upper part of the intestine.
So let's talk about what are the type of peptic ulcers.
Definitely. We are all aware of the mouth ulcer because they are easily be seen. But there are many ulcers which are residing inside our body. So depending upon the location, it is divided or classified into three categories. First, that is located on the lower part of the food pipe, that is called esophageal ulcer. Secondly, the ulcer which are residing or located in the stomach, that is called gastric ulcer. Or the third one, that is present in the upper part of the intestine, that is called duodenal ulcer.
If you are suffering from duodenal ulcers, patient usually wakes up in sleep and complains about upper abdominal pain, and the pain is burning or dull aching type of pain.
Now we're going to throw light what are the causes and the symptoms of the ulcer.
Now, talking about the causes of gastric ulcer, the most common cause is H. pylori infection. 60% of the patients which are suffering from gastric ulcers come with H. pylori infection positive. H. pylori, that is Helicobacterium pylori infection. This infection basically colonizes in the bottom of the stomach, and our immune system is unable to clear the same, because of which there is increased secretion of gastric acid, and this erodes the inner lining of your stomach, causing the gastric ulcer.
Secondly, NSAID, that means non-steroidal anti-inflammatory drugs. Here the gastric mucosa protects itself from the gastric acid by a mucus layer. And this layer is formed by the help of prostaglandin. But when we increase the intake of non-steroidal anti-inflammatory drugs, it inhibits the production of cyclooxygenase. And this cyclooxygenase is very important in forming the prostaglandin. But when the cyclooxygenase is inhibited, the prostaglandin will not form. And when prostaglandin will not form, the internal mucosa will not form. It will probably increase the risk of ulcer.
The next cause is diet. When there is increased intake of spicy foods or there is increased intake of coffee, tea, it will probably increase the cause of gastric ulcers.
Next one, when you consume alcohol or you smoke a lot, it will probably increase risk of getting peptic ulcer. One of the major factors is stress. As I have already told, the stress is directly proportional to your autoimmune system. And when you stress or you are living with a stress, the probability of getting any kind of disease, it will increase.
Till now, we have studied about the causes of gastric ulcers. Now we will discuss about the symptoms of gastric ulcers. The first most common symptom is pain in abdomen, that is pain in upper abdomen, dull aching pain, burning type of pain, or there is belching.
Loss of appetite, or there is a decrease in your weight. Water breath. It means then when there is an increase in the sore belchings, the pH of your esophagus gets acidic, and to neutralize it, the formation of saliva increases. That's why you feel a watery discharge in your mouth a lot.
There will be nausea and there will be copious vomiting. Because of this vomiting, there will be vomiting of blood sometimes, and there will be blood in stools. The stools will be foul smelling stools, which is called melena.
When these ulcers are remain untreated for a long time, it will start penetrating or perforating your gastric lining. All the fluid from your stomach started collecting into your peritoneal cavity, that is called ascites. If this ulcer persists for a long time, it can be converted into the carcinoma of the stomach or the cancer of the stomach. Secondly, it also affecting the adjacent organs like liver, pancreas or spleen.
So, today we have learned what are gastric ulcers, their causes, symptoms. So, if you want to know about the prevention and home remedies of gastric ulcers, you have to wait till our next episode.
If you do like our episode, subscribe our channel now.
Like, share and please comment, as your comments will promote us to bring this kind of information in future also. See you soon.
Bye.